There is a huge turnover of staff. It's not necessarily paid well. There isn't anything like sick pay or any benefits.
Care workers not being acknowledged in a sense of what their work and their worth is.
In this crisis, some of you, lots of you, are at home, living a life less ordinary, but tolerable. Yet there are those we now laud as heroes, whose everyday existence is all too familiar to what went before, which is precisely the problem. You applaud them week after week, but those people, carers, are being forced into the most invidious of choices long of our making.
For years now, social care has been charitably the neglected child, less charitably the dirty little secret of the welfare state. Problems over pay, training and conditions have accumulated under governments of all colours. What you're about to hear is how those structural problems are returning to haunt us, and almost certainly in this crisis, costing lives.
As Newsnight has covered the unfolding crisis in care homes and domiciliary care these past months, sick pay, or lack of it, has been a repeated complaint. This is a sector where the vast majority work on the minimum wage, and depending on where you are in the country, up to 50% are on 0 hours contracts. But worse, as Zoe, a carer and union rep in Walsall, explains, the poor working conditions in the sector are themselves now promoting this disease.
Unfortunately, people are going into work with symptoms because they're not getting any type of sick pay whatsoever. They're just not being tested.
So people are symptomatic, potentially COVID-19, they don't know for sure, but they're still going in anyway.
A lot of people are very concerned about the money because there's been no real government guidance on what carers can get paid.
I mean, that must feel like an invidious choice. I mean, for carers having to choose between thinking, oh my God, I might be going into work and infecting people.
Yeah.
But also I can't afford to go sick. I mean, that must be a really terrible dilemma. We do get a
lot of, even without the coronavirus, but more so with it, we do get a lot of carers that won't go off sick because of sick pay.
Caroline, a carer in a home for disabled adults in London, has witnessed the same thing. Carers having to work, even when they have COVID-19. Not all carers are entitled to statutory sick pay, and even if they are, remember, it's only £95.85 a week.
There was an incident where this care worker, she came into work knowing that she had tested positive, which all of us were shocked by. None of us were impressed by it, but she ended up coming into work, and the reason was because she needed have bills to pay. So unfortunately, I agree with the decision she made? Of course not, but I think I do sympathise with her in terms of the reason why she came into work. When you're put in between a rock and a hard place, you have no choice, and you have bills to pay. You have no choice but to choose.
But presumably, that's got to be a real danger to residents, hasn't it?
I was definitely upset by what she had done, but I think there's always going to be two sides to it, and unfortunately, because of not having sick pay within our contract, unfortunately, that's led for her, in her situation, for her to come into work.
We have a lot of people that may be single parents working in the care sector. Like, I work with a girl that has 2 children and she's on her own, and if she showed a symptom, she doesn't live near a family or anything, so she would have to choose to stay at home isolating with no pay whatsoever, not be able to afford a rent, not be able to buy food for her children, have to rely on food banks, or she could choose to come in, hide a symptom, carry on working so her children have got food, and then risk killing somebody whose job it is for her to look after. It's the opposite of it. Makes people who are going to work to care for people be the risk to the people that they're caring for, and it makes us be the people that are putting them in danger.
In some cases, it goes further still.
The union has had reports that people don't want to be tested or refusing to be tested, and the companies have also reported this, so they're aware that the staff are doing it.
Caroline and Zoe aren't alone. A recent GMB survey of carers found that if they got COVID-19 symptoms, 12% said that they would go to work anyway because they couldn't afford to live on statutory sick pay. That doesn't sound like much till you consider there are 840,000 carers in the sector. Imagine what could happen if even a small number of those carers were infected and felt forced to work. Some big care companies make a fortune. Some could afford to pay sick pay. It's also true, though, that social care is dominated by small independent providers, increasingly wondering how they'll stay afloat. Who'd put their relative in a care home right now? Mike runs 4 care homes in North Yorkshire.
Most of our work is delivered by local authorities who don't fund us sufficiently well enough to deliver the services. I would like to be able to pay staff their full salaries when they're off ill, but it just isn't possible. If I did that, to give an example in the pandemic, for those who are off shielding or self-isolating now, it would cost me around £9,000 for the last 4 or 5 weeks. That's just half pay. If it was full pay, about £18,000, which would really wipe out any profit or surplus that we have, and therefore we'd be running at a loss. I can hear people saying, perhaps it's a business, shouldn't we be paying? Well, my answer to that is the government is paying for staff who perhaps work in other industries to be off work so they don't lose their job, 80% of their wages. I'm only asking for something similar.
Government says it's looking to understand why the situation in care homes is so bad. Sick pay is only one element of that story, but it is one which could be remedied quickly and relatively cheaply. Carers are the front line of this battle. They didn't ask for it, but they've got it. Understanding the situation they are in, of those they care for, is what they're asking of us.
Lewis Goodall reporting. The government told us in a statement, we've set out a comprehensive action plan to support the adult social care sector in England. This includes making sick pay more generous and refunding 2 weeks of employers' cost of sick pay where they have up to 250 staff. In addition to this, there's further support through universal credit and other government schemes.